Good evening. Welcome to tonight's live as we have a special guest coming on, Sandy from OsteoStrong. For this month is Osteoporosis Awareness Month, and we want to bring more awareness to our community. So we have partnered with OsteoStrong for Lauderdale. Welcome. Good evening. How are you?
Hi, Tracy. I'm doing well. How are you?
I'm good, thank you. It was easy to get on, right?
Yes, yes. Now, I am using new earbuds, so if I don't sound right, just let me know.
No, you
I've
sound
never
great.
used these before. Okay, perfect. Yay!
Awesome. Well, thank you so much for joining. We're so excited to have you here tonight. And as we get started, I want to let the listeners know that as you're tuning in, make sure you stay until the end because we have an amazing giveaway that OsteoStrong is partnered with to give back to the community, and as
Yeah.
well as I will be doing a giveaway as well. You know, normally I don't do them. Last night was a little different, but I'm like, I like this idea, so let's give back to the community, as obviously that's what we're here to do. So for those of you that don't know me, I'm Tracy, the founder of Dexa Strong, where we eliminate the emotional and financial burdens of survivors, purvivors, and thrivers, regardless of predisposition, to eliminate the feeling of isolation and help you feel whole again. Knowledge is power, and this month is Osteoporosis Awareness Month. And I had really just learned about Osteoporosis Awareness Month. Yes, I do have osteoporosis myself from my preventative mastectomy, but learning from you on our calls that osteoporosis obviously affects our bones, whether it's treatment, whether it's preventative, and, you know, what can we do to prevent it? How do we avoid getting it? And making sure we're getting the right education. So thank you again for coming on. Maybe you just want to do a short introduction and then we can start.
Thank you so much. So I'm having difficulty with my earbuds. Can you still hear me okay?
I can hear you.
Okay. I don't know how to use these things yet, so all this technology is sort of new to me, so I appreciate your patience. I don't hear you through my earbuds. I hear you through my phone. But anyways,
Okay.
I am Sandy. I am a nurse practitioner by education, certification, and training. Particularly, I've worked with adults in gerontology my entire career. I started out in acute care setting, so working in ICU, neurosurgical, medical, and then I transitioned into private practice in cardiology. And so I've always had a soft spot for individuals and their health and their well-being. And that's how I sort of got into owning an OsteoStrong. So that is a disclaimer. I do own OsteoStrong here in Fort Lauderdale in Florida. But my passion for being here and my goal is to really empower all individuals that can be predisposed or are at risk or have osteopenia or osteoporosis. So that's my purpose for being here, just to hopefully share some insight, open up the doors for questions with individuals and their physicians, because I'm a big proponent of being educated. Education is a form of empowerment. So that's why I'm here. Thank you so much for allowing me to share the little bit of knowledge that I have with your members.
Well, thank you again. I appreciate it. And, you know, if you can start off with just explaining what is osteoporosis.
I'm so glad you asked, Tracy. I want to first start by saying the important things that the bones do. So osteoporosis is a condition of the bones, basically, right? But bones they do so much more than just support us. They really help us with protection, with movement, with storage of minerals, with our immune system, with energy production. So keep that in mind as I'm talking through this whole process, right? Osteoporosis is a condition where the bone is thinner than what it should be for your particular age, right? They always use these measures to compare us to other individuals. So they measure our T-scores, basically, and the lower the T-score or the lower the C-score, which is I'll talk about later, that puts us a higher risk for fracture. Um, and so when your bone is thinning, there's all these things that happen with thinning bones. And an important thing to note about bones is that no matter men and women, how you were born, what gender you were when you were born, after the age of 30, you're going to develop more bone loss than you are going to be building bone. So after the age of 30, up to age of 30, we're in this trajectory, beautiful. We're developing more bone than we're using, but we hit that third decade, man, and everything sort of starts to decline, right? That's a natural aging process unless we do something about it. But add other things, other risk factors to that, and then that can be a really steep and dangerous decline. So osteoporosis in a nutshell is thinning of the bone, and can predispose you to fractures.
And how is osteoporosis diagnosed?
So there are multiple ways to diagnose. The most common way to diagnose osteoporosis is through a Dexa scan. So a Dexa scan is a type of X-ray where they put you in this machine and they will take different measurements from different parts of your body. So they'll take the measurement of density in your femoral head, your pelvis, your radius, your ankle, and your spine. One thing that's really important about Dexa scan, they're not the most reliable, and they can, if they're not repeated with the same machine, same technician, they can give you false positives or false negative results. Now, there are other ways to diagnose. Ultrasounds are another common way. Those are more screening types of things that can be done. So like, for example, if you go to a health fair and somebody says, hey, a free bone scan, and they do a little scan on your wrist, that's more through an ultrasound. They're not really to diagnose. CT scans can also be done to diagnose. They have a little bit more of an exposure to radiation, but it's still less than a typical CT scan, a general CT scan. And those can be done safely and outside centers as well. And somebody just mentioned you need to start with a baseline. Yes, it is so important. So I'm going to stand on my soapbox here. We are not diagnosing and we are not monitoring individuals at an early enough age, in my opinion. Okay. Typically, females will be suggested to have a DEXA at the age of 50, unless, of course, you've had other risk factors in hand. Breast cancer, other types of cancer is a risk factor. Other ways to not necessarily diagnose osteoporosis, but a way to follow treatment is through blood bone markers. It is not a common standard of care at this time, but that's why we need us, right? Because we need to revolutionize the way that this condition is being assessed and treated, looked at. So these markers that you can collect through blood can tell you what your production of bone looks like. So whether or not you have more cells that are producing bone rather than more cells that are breaking down bone. So those are some ways to diagnose osteoporosis.
You know, it's interesting when somebody talked about baselines, you know, I'll never forget when I requested my baseline before I started my hysterectomy because I knew, you know, it affects bones. And a lot of women don't realize how it affects them with their bone health. So what I strongly suggest as a provider of 6 years, I know I went to osteopenia, to osteoporosis. I suggest that anybody who's going through a Proviver, Survivor, or Thriver, you get that baseline scan. It's easy. I believe there's no radiation. It's an easy test. It takes 5 minutes and you get your results. But having that baseline is imperative because it can determine your treatment plan down the road and what happens. You know, that goes into my next question is, you know, why is it important for individuals who are Provivers and Survivors to be aware of osteoporosis, to be aware of what's going on with this? So after breast cancer diagnosis, is the osteoporosis testing automatically tested. I can tell you from my end, we do not see it. I encourage all women. I'm not really sure what you see, but I know from a lot of my survivors and providers and metastatic women I've learned that it's not being offered. And that's why we have to be our own advocate. And that's why I feel so strongly about having these calls, because nobody talks about osteoporosis. Nobody talks about bone loss. And it's just not your bones. It's your jaw. It's your gums. It's everything.
Exactly. And if you remember at the beginning of the conversation when I talked about the important functions of bones are not just there to support us physically, right? But they do so much more than that. You know, so I want to make sure that people don't think that just because you have breast cancer, you automatically will get osteoporosis. It's likely the treatment from your cancer that can cause osteoporosis. That is the biggest risk factor, or the treatment. So if you have a medically induced hysterectomy, or I'm sorry, a medically induced menopause, in other words, hysterectomies, that's a major factor, a risk factor. If you're being treated for breast cancer with certain medications, those are other risk factors. So, for example, there are 2 medications that have a high risk for causing bone loss. Anastrozole is one of them, and the other one is aromacin is another one, or exemestane. And so those are 2 high-risk medications. So if you've already had a hysterectomy and now you're being placed on these other meds, that can just increase your risk. Now, I will tell you, I am pharmaceutical neutral. I would never encourage or discourage a person from taking any medication. That's a very personal conversation that you have to have with your physicians that you trust. But just know that, you know, have that conversation with your physician. Hey, listen, I'm on Synthroid as well. And of course, your oncologist and your team of doctors, they're going to know this stuff, right? But again, I want you to be aware, to be empowered that these are the possibilities. Hi.
Good
Hey,
evening.
how y'all doing?
We're doing great.
Great.
We're doing great. Thanks for joining us.
Oh, I'm enjoying the conversation. I'm sorry I couldn't join it sooner. Queen of multitasking here. Every mom ever, right?
Correct. Correct. I love it. I love it. So I was just mentioning how certain medications for the treatment of breast cancers can place you at risk. And yes, they're putting other medications for medications. Now, tamoxifen and raloxifene, those are 2 medications that actually can have protective factors for the bone. And typically your physicians care for you, okay? Your physicians are not going to put you at higher risk for other things. They're going to typically go for the medications that are safer for you in consideration of all your other conditions. So keep that in mind. I don't want to discourage anybody or make anybody super afraid and be like, oh my God, I'm on this medication. If your physician puts you on that medication, it's because you have other risk factors that don't put you as a candidate for the other meds. So my purpose is just be aware, just have that conversation with your physician. Other medications, PPIs, so proton pump inhibitors. You know, we can go to the grocery store and just pop these in like crazy now, and those can put you at risk for bone loss. High doses of Synthroid as well. I mean, there's other medications like steroids, SSRIs, still medications like Prozac, Zoloft, Paxil. Even certain birth controls. I think Depo-Provera is one of them. Trying to think of any other ones. I'm drawing blanks. But my point is, meds have side effects. Know what medications you're putting into your body. Have that conversation with your physician, because so many of us are afraid to just ask a question. And they want you to ask questions. They really do. And I can tell you personally, because I've been there. I'm a nurse practitioner, and I have diagnosed, and I have treated, and I have used a variety of meds as well. So anyways, I'll get off my soapbox.
One of the questions is this something that accelerates because of chemo, or just the diagnosis alone is a factor?
You know, I don't think that just a diagnosis is a factor. It's mostly it's the biggest risk factor is the treatment options that we have, right? So medications, surgical procedures, radiation that can lead to other things, right? If you have radiation close to your neck, it could affect your thyroid, right? And I mentioned Synthroid is a medication that's used for thyroid conditions or hypothyroidism. And so it is likely not the diagnosis that's going to predispose you. It is likely the course of treatment that can predispose you to that.
You know, Dr. Alexia, I know you were tuning in. I don't know if you want to speak or say anything before we go on to the next question. I figured it was perfect timing as Dr. Alexia is our medical director and is also a survivor.
Yeah.
So I think we're talking about the medical part of it as an infectious disease survivor, speaker, her whole spiel, you know, would be perfect time to chime in. And if there's anything that we missed so far.
No, you guys have covered the gamut. I was able to tune in from the beginning, and, you know, the mention of the fact that, you know, we put down our maximum bone density by the age of 30, and then after that we're losing it. So when you think about all of the young women we've come across and encountered who got diagnosed at, you know, 18, 21, 25, you know, right in their 30s, when they're at the peak of their bone health, and then get thrown into menopause, we're losing bone 20 years earlier than we would have. And then on top of that, estrogen loss or estrogen blocking medications, you know, you really have to consider like what ways you're contributing or not contributing to your bone health. So, you know, are you exercising and being physically active? You know, are you supplementing appropriately? And are you taking doses that are therapeutic for where you're at in terms of your vitamin D levels or your magnesium levels and your calcium levels? And so there's so much to talk about. And I think especially those of us that are younger survivors or previvors, like these are things that our primary care doctors may not even think of because it's not something they're talking about with their 30 or 40 something year old patients. It's what they're talking about with their 50 somethings and their 60 somethings. And so we can't always blame our providers, right? We know what we're at risk for. And sometimes we're that 1 in 1,000 patients that somebody sees. We're not the standard patient, and it's okay to give our providers a little gentle nudge and to remind them, oh, by the way, you know, I've been in menopause since 26 or 30 or 40, and I need to get my bone density tested now. You know, my patients, you know, they know when they got their last bone mineral density. I don't always know. And so it's a test that's, you know, not usually done except for every 2 years. It's not done annually. So you have to be careful with that for insurance coverages. It's just so much that goes into it.
But, you know, when you talk about women who have preventative hysterectomies, right, I think that often, from what I've seen in our community, and you probably see it too, we're not really told about osteoporosis. We're not told about going on vitamins like dralexia.com/supplements. Look at that. And the supplements that we're not told about and shared, I think is really important in what we put in our body. Yeah. You know, everybody could just go to GNC and buy something, but like actually taking care of your health and moving forward and knowing more about your bone health and maybe trying an OsteoStrong, you know, like Fort Lauderdale has, and seeing the different options that are out there, because bone health isn't spoken enough about, I feel, in our community. I know a lot of women out there are saying, we have several women on this call tonight, what's a Dexa scan? You know, should I get one before? Yes, as a provider and you're having a hysterectomy at a young age, I strongly suggest getting a Dexa scan. I don't see it as a protocol. I don't see it as a gold standard. So make sure that you're educated on it and knowing, you know, the medications that have side effects, knowing what needs to be done, you know. And going back to Sandy, is exercise enough? You know, what do we...
So is exercise enough? The answer is no. If you're a great swimmer and you're doing Pilates every day of your life and you're not having any sort of impact on your bones, that's a problem, right? because bone actually responds and continues to grow when there's impact, when there's forces, right? Or heavy loading. That's a well-known law of human physiology. It was discovered in the 1800s. Some German surgeon called Dr. Wolf. He is very important in physiology, by the way. He's not just some German physician. But so yeah, he was the one who actually discovered that in order for your bones to grow, they need to be stimulated by forces, by impact or heavy loading. Now, it wasn't until recently that we realized that we need a significant amount of loading and of force to produce bone. So, for example, there was a study that was conducted in 2012 where they had over 2,000 participants, and they put accelerometers in people's hips, so meaning they were measuring the velocity of which their bones were impacting. And just the hip, in order to develop bone in the hip, you need 4.2 multiples of your body weight, which is a significant amount, right? So, I often get individuals in here that say, oh, my doctor told me to go eat more dairy and, swim some more and walk. And I'm like, that's great. What else are you doing? Well, that's all I need to do. No, that's not all we need to do, right? So calcium alone, first of all, in the countries that have the highest consumption rates of calcium, we have one of the highest rates of osteoporosis. Why? Because we're not intaking the other minerals and supplements and vitamins that we need to absorb that calcium into our bones, right? So, like Dr. Alexa, correct? Mm-hmm. Okay, like Dr. Alexa mentioned, vitamin D3, magnesium, K2. I am so surprised at how many people walk through my doors and they have never heard of K2. I'm like, well, if you don't have K2, it's not being pulled into the bones. It's not doing anything. It's just swimming around in your arteries, in your brain, in your heart.
What is K2? What is K2?
Yes, so vitamin K2 is a very important vitamin that we need, and it's different than K1. So it's different than, a lot of people are scared of vitamin K because they think, oh my God, I'm going to clot, or, it's bad for me because I'm on Coumadin or whatever. But it's very different than K1, and that's like, nutrition is a whole other talk that we could do about osteoporosis, and I am not a certified registered dietitian, and I will not claim to be one. But I do have enough to tell people, listen, go talk to a registered dietitian, especially a functional nutritionist. I am so much in support of functional nutritionists because they treat the whole body, right? They're not just looking at one thing. And not all supplements are created equal. And not everybody needs the same amount. So just like Dr. Alexa was talking about. So is exercise enough? The right kind of exercise, so like if you're jumping from a 5-foot box, that's okay. If you are lifting 4 or 5 times your body weight, that's okay too. But just walking with 5 pounds here and there, swimming is great for individuals with osteoporosis because it's low impact. There's low risk of injury. Pilates is another great thing because, again, low impact and great for stretching, but it's not doing much for your bones. And I get so many individuals in here that come in and they're mad at me. Because they see me out there talking about OsteoStrong, and they say, well, listen, I'm in the best shape of my life. I'm exercising. I'm eating right. Here's my list of supplementation. And they really are. What can you do that I'm not doing already out there? And I say, well, here's the thing. You're not impacting your bones with enough stimulus. That's the reality. We're not giving our bones the necessary stimulus to continue to grow beyond the age of 30, beyond all of those other risk factors that we're exposed to.
So a couple of questions have come in. Uh-oh, I just lost them. Hold on. Dr. Alexia, do you know how to pull up the questions?
Let's see. Oh, let's see. Yep, I can.
Somebody said K2 brings D where it needs to go in your body. Correct. K2 brings the calcium into your bones. Can you be on chemo and take K? I'm not qualified to answer that question. That would be a question to ask your physician. I remember there's a difference between K1 and K2. K1 you typically get from those green leafy vegetables, and K2 is from mostly fermented products, which we don't take a lot of in our culture here. But no, that is a question that you need to talk to your physician because different medications can put you at risk for blood clots. I'll keep scrolling.
I think there's one more.
Is walking at weight-bearing exercise? It is bearing your weight. Now you can put, which is not enough. You can walk your entire life and do 20,000 steps a day, but it's not enough to stimulate your bone growth. And that's why we continue to we lose more bone as we age past the age of 30, right? Now, if you're walking with like, 4 times your body weight, then that may be a good start, right? But walking is very good for cardiovascular health, so I would never put it down. For sure, keep walking. It's good for that.
So I don't know. Talk a little bit about OsteoStrong and how it works and how it can help our community.
All right. Before you ladies get into that, I'm gonna sign off. I'm going for my walk. I have a walking date with a friend.
Get those bones moving.
That's right. Listen, I know that I'm walking for my heart health. I'm walking for my emotional health and well-being. Walking staves off dementia. And I'm going to watch the rest of this on the replay because I need to learn more about how I can incorporate more weights into my exercise to build my bone because I'm not doing it right. So thank you so much.
Before you log off, don't forget, we could check out Dr. Alexia's supplement page on dralexia.com/supplements, bone health, magnesium,
potassium, boron.
There's all kinds of products
phosphorus.
That are out there, all by Dr. Alexia. So if you guys have any questions, you can check her out on her website or you can message her for more information.
Thank you. I appreciate it.
Great to meet you, finally.
Great to meet you as well. And we'll connect again. Everyone have a great night.
Bye.
Bye.
So, Sandy, let's go into a little bit about OsteoStrong and how it works and a little bit about the program so people on the call can learn more about what you do. And I know there's centers outside of the state of Florida that they can look into.
Correct. Yes. So OsteoStrong is a place where individuals come to work on their bone health. Remember how I mentioned that you need to stimulate your bones with enough forces to get that response from your brain? So, well, first of all, we work with your brain. We're a biohack. We're not a gym. We use these cool devices behind me here that look like gym equipment, but they're not. I promise you. You're not going to sweat. You're not going to feel sore or fatigued when you come to do our therapies. But what we do here in a very basic layman's terms is you apply pressure to your bones. That pressure, when you apply enough pressure, it helps your brain to be triggered. When your brain is triggered, remember I talked to you about Dr. Wolf? When you trigger your brain with impact emulation, which is what we do here, osteogenic loading, your bones send a signal to your brain sends a signal back into your bones, and you start to produce more bone tissue. We have these specialized robotic devices that allow you to apply the necessary forces to produce bone. Now, producing bone is great, but there's so many wonderful benefits that you get when you start working on your bone health. So when you start losing bone, your posture starts to be affected. Your balance becomes affected. Your muscles become weaker, something called sarcopenia. And you start to get loss of flexibility, loss of reaction time. Your joints become a little bit more stiff. And we've always associated that with aging, right? Oh, I'm getting old. It is what it is. No, it's not because you're necessarily getting old. It's because you stopped stimulating your bones with the necessary forces. So here at OsteoStrong, we help you with all of that. We can see improvements not only in your bone density, but balance, posture, pain. Why pain? Because your ligaments and tendons and muscles and bones are all attached to one another. It's a beautiful symbiotic relationship. So as your bones are getting stronger, your muscles are getting stronger, your ligaments and tendons are getting stronger. So you start to even see decreases in pain and improved mobility. Our sessions take about 15 minutes, 10 to 15 minutes to get through. You use 4 devices as part of the circuit. And we do this once a week. And that's it. And there's over 150 studios throughout the world. Here in South Florida, we have one of the largest growing areas in the world. So that's really exciting and cool. I was the first one to bring it to South Florida. And then there's a bunch of us now collaborating and working together to really make a difference in our communities. And really, and for me, it's much more than that. I want to revolutionize the way that specifically osteoporosis is being looked at. Dexa scans every 2 years, that's unacceptable. Dexa scans when you turn 60, that's unacceptable. We need to be doing it at an earlier age. So yeah, that's what we do. That's my passion.
That's absolutely amazing, like what your goals are to help the community, men and women. And, you talk about, when you're 60, maybe we need to go after and implement, when you have a preventative hysterectomy or when you have a hysterectomy due to breast cancer, like varying on why you have that hysterectomy at a young age, we need to be monitored, the same thing for survivors. Why are we waiting until these treatments have side effects of osteoporosis? Like in the beginning, wouldn't it just be easier so we can go to centers like OsteoStrong for Lauderdale and continue to take the preventative action ahead instead of waiting? Because all it's doing is hurting us. It's not helping us. And I mean, I couldn't possibly imagine that a Dexa scan is costly. I know our medical community has like all these little glitches. It's not expensive. And to me, it's mind-boggling that we can't make that difference. So, there's always room for making that difference in the medical community. And if there's anything that we can do, like getting women to write testimonials and getting information out there, you let us know, because I'm game to help you to make a difference. And I know what it's like to live it. And, women suffer, and men suffer too, I'm sure. Obviously we deal with more women, but nobody should have to suffer when something can be prevented, right? Like if we can prevent bone loss as you get older, why not do it?
Yes, Tracy, you've hit the nail on the head. Prevention is so much easier than treatment. Now, we don't treat osteoporosis here, right? This is just another way for people with bone loss to get that necessary loading that they need. But, when you come to my center, because of my background, I can't help but, try to advocate for you. We're going to talk about, frequent testing. We're going to talk about your nutrition. And I have a great partnership with a lot of experts in our area that I can, suggest so that you can go see or talk to. And that's what it's about. It's about collaboration, right? Because me by myself, I can only do this much, but
when you get
impact. Yeah. Like one of my things is OsteoStrong should be covered by insurance, so we're working hard on that. But, just like chiropractic care is now covered by insurance, it wasn't early on. It is now. We'll be there one day. We are already in Australia. We're covered by their healthcare. Insurance covers OsteoStrong. So we're making progress. A little bit at a time.
Being that voice is what we need. One of the ladies says she's 44 years old. I had a hysterectomy 3 years ago and I'm already osteopenic. Those are things that, again, need to be spoken about. And what can we do? And is there an OsteoStrong everywhere? Maybe being that voice, ladies, standing up and this is what we need. And this is what's going to make a difference in our community is us coming together to do this, right? So yes, I agree. It should be tested more often for higher risk patients, 100%. Why isn't there a gold standard when you carry a genetic mutation and you take preventative hysterectomies, right? Gold standard should be, let's have a Dexa scan every year. You wait 3 years and bam, you're already osteopenic or full osteoporosis. Treatment is really basically your only option. They tell you, they're not telling you about go do impact exercise. They're telling you don't do impact exercises, that's the problem, right?
Yes. So I have a quick story.
Well, before you do your story, let's do one giveaway, and then is your friend ready to come on as well?
Yes. So BeFree.love is she's actually
Do you
one of
want
our
to add her?
members. Oh,
Do you want to add her?
how do
You know
I do
how?
that?
Okay, so first let's do this. Before you tell your story, we'll do the
Okay.
first giveaway, and then I'll add her on. So what I'm
Okay.
going to do is, for those of you that know me, obviously I'm the founder. We have been honored to partner with two more businesses that are shop for a cause in our community. And it is the Spa Mask, which is a mask that sticks to your face, so you don't have to wear the ear wraps, and it's breathable. They're KN95s. So we'll be gifting one of these, and we will be gifting the Tummy and Breast Buddy by the Chest and Breast Buddy, which is a pillow that you can put on your seatbelt to avoid any discomfort or on your stomach once you have surgery. So what I'm going to ask is for somebody in the comments to explain what osteoporosis is, and we will determine the answer. So for all the listeners out there, Sandy went over and said what osteoporosis is in a nutshell. If you can just take a couple of those words and type them in the chat, the winner will be chosen. And then Sandy, you can tell your story while we add in your friend, and then we will do her giveaway.
Okay.
And it's BeFree, right?
BeFree.love. Yes, I did see her join earlier.
Perfect. I got her. Awesome. Go ahead and tell your story.
So one of our members is a young, very athletic individual. And hi, Linda.
Hi.
So yes, a young, very fit, athletic individual, very active, happy, high on life. She was diagnosed, so prior to her diagnosis of osteoporosis, she was a big competitor in high intensity competitions. So Spartans, the mud runs, all those crazy things that, those wild athletes do. Really exciting stuff. She was diagnosed with osteoporosis, and she stopped all of that. She never fractured, but her physician gave her this, terrible diagnosis, super scary, and she stopped doing the things she loved to do, and there's such a thing called disuse syndrome. So if you stop using a part of your body, you're going to lose it. And she started coming to OsteoStrong. She regained some of that confidence back, and she competed in a Spartan race last week.
She's coming on. She's our guest next week, Casey. Right?
Good. I'm sorry?
Are you talking about Casey?
No, but I want to meet Casey. This is another person, just like this member of ours. But she competed. She developed the courage again. She competed. She's been coming for OsteoStrong. She's doing wonderfully here. I mean, her strength gains are through the roof. It's incredible. She hasn't redone another Dexa scan because it's not time for her to redo one. But not only did she compete, she finished fifth. Okay.
That's amazing.
So, yeah, so those are the types of success stories that we love here at OsteoStrong, that I love to celebrate because, and I have people, again, like they're playing tennis, they're golfing, they're running again, because they're not so afraid anymore. So, or they're getting stronger. So that's a little story that really excites me.
Awesome. I love it. We actually you have to join us next week. Casey she was an American Ninja Warrior. She did the Spartan racing recently after she had underwent a recent uterine surgery. She's going to be on next week. You have to tune in. You'll love that call, and I'll connect you. So the first giveaway is the real Steffi. Congratulations, you are the winner. If you can please send me a DM with your information, that would be absolutely amazing. Again, the real Steffi, you are the winner. Now, let's welcome another guest that we have tonight. And Sandy, if you want to introduce her, just because I know you know each other, if you want to just do a short introduction yourself, whatever is best for you.
Yeah, so this is my friend Linda. We met here through OsteoStrong. Now, Linda's story, I'll let her share it, but I invited her over because she is a former nurse, just like me, and she makes these amazing products. And so I thought, you know, here's a group of individuals that are always looking for ways to care for themselves. And I thought, oh my gosh, it would be so wonderful to invite Linda to talk about her products and you know, share with you what she has.
Perfect. Linda, before you get started, Sandy, do you first, somebody's asking again for the answer of what is osteoporosis, and then when you're done answering that again, if you want to throw out a question and then whoever answers will get it. You want to do the second question?
All right. Yep, sure. So osteoporosis is basically thinning of the bones that can predispose you to fractures. And the cause can be multiple reasons, multiple risk factors. So genetics, medications, treatments, conditions can be the cause of bone loss. And typically, you start losing bone after your third decade of life. So once you're past that 30 years, then that's another risk factor for you.
Awesome. And
so the next question is, okay, this is a very simple one. How many multiples of your body weight do you need to develop bone in the hip? And Linda, you can't answer this because I know you know. So how many multiples of your body weight do you need to lift, push, or pull with your lower body in order to develop bone in the hip?
Okay, perfect. Linda, do you want to do an introduction while we're waiting for the answer?
Okay. Well, my name is Linda Beaulieu, and I am a co-owner of BeFree.love. Be free meaning free of, it's free of alcohol, free of toxin, paraben free, vegan. We're animal and cruelty free. We're sulfate free. I'm an RN. I'm still an RN that collaborated with my son, who we both have allergies to different types of substances. So we co-created this company, BeFree.love, to manufacture products. We have a self-care kit that has coconut balm in it. It's coconut balm, argan, and vanilla. It feels like silk. You can use it in your hair. You can use it on your face. Use it on your body. And we have a BeFree.love. It's called Breathe in Joy Balancing Aromatherapy. It's a tangerine, an orange, citrus smell that just makes you feel very, very relaxed and balances your energy, which I think many of us need today. Individuals can use this. All individuals can use this, because our products are eco-friendly, they're reusable, they're recyclable. We try to be eco-friendly because we're conscious of our environment. I, as a nurse, am very comfortable with the medical model, and along with transitioning to a more natural foundation of learning in my adult years. So it's a nice combination of knowledges, because I feel comfortable speaking with persons who have osteoporosis. I have osteoporosis. I've had osteopenia. I've seen myself go through the transitions. And OsteoStrong, I have to say this about my attendance there in the last 2 months. I feel invigorated. And I'm very critical. I'm a critical thinker. I analyze my body. I know how I feel. I'm in touch with myself, as I think most people are. Most people, if you listen to your body, it tells you something. It may direct you in the way you need to go. I think our physicians do the best that they can with what they know, but there are many modalities out there in terms of treatment. So hence we have BeFree.love, which is technically a health and beauty tech company. And what we seek to do is enhance self-care, because we realize that we live in a society today that really has a lot of challenges. So I'm going to try and hold up the kit. This is our kit, if you all can see it. Everything is biodegradable, reusable. It comes to you this way in the mail. Here is the balm, if you can see that. It's a coconut balm. We also have a spray. This is a spray that has 7 essential oils in it in distilled water. It can be used to refreshen the air, freshen countertop surfaces, use it in your car, use it on your hands. It's not meant to be a total body spray. It's a cleansing agent. But again, it's alcohol and it's toxin free. And this is the roll-on, which is, again, has that lovely orange and tangerine smell in it. It also has yang lang, which again balances energy. So the combinations together form this kit. You can use, it's meant to be used as an experience, a daily experience. You can use it whenever you feel the need. Some people tell me they carry their roll-on in their purse. They carry the healthy immunity spray in their car. The balm, because it's temperature sensitive, above 76 degrees might melt because it's preservative free. We use high quality products. And I can say that because that is what I want to put on my body, is something that is high quality. So I appreciate the opportunity to even speak about this, because listening to the entire program, it all ties together. So I'm very, very happy to contribute this gift to someone who is chosen tonight.
Thank you so much. I really appreciate it. And I would love to connect after the call. You know, having these products available, especially to our survivors who are going through chemo and radiation, and, you know, having all these chemicals and giving them something that's different is definitely something we're interested in talking about, maybe incorporating in our pre-mastectomy care packages. Is that's what we do at OsteoStrong, is we actually fund women pre-mastectomy care packages. So prior to heading into surgery,
Very nice.
prior to surgery or treatment, we want to provide something to them that keeps them going and just provides a smile that right now obviously is very hard, as a lot of us are facing it alone, as it's due to COVID-19. You know, going into these things alone isn't easy. So always providing a way to uplift our women is something that we're always looking to do.
Any way I can help, I would be happy to do so.
Thank you. So Sandy,
thank you.
You're welcome. What is the answer?
So the answer is 4.2 multiples. 4.2 multiples of your weight is what your body requires to develop bone in the hip. I didn't see anybody say it. I saw a lot of 4s. I saw some 3s and some 5s and some 6s. But the minimum is 4.2.
So are we going to go with 4 or are we going to go with 5? I think we should go with 4.
I think 4, yeah, 5 is a little much. I mean, you can obviously produce, but I don't know, because 4 may not be enough, but 5 is definitely enough. So,
How about 4X? I like 4X. What do you think?
Oh, somebody just posted 4.2.
Oh,
did you hear
that?
So I'll let you decide. I have a very small screen that I can look at the participants. So
4X. I'm not sure when Vegan Cosmetics posted it. So I don't know if you want to choose the winner. Do you want 4X or 4.2?
Well, I think 4.2 came after we mentioned the 4.2, so I'm not sure about that. I think it should be the first person to say 4X.
Perfect. So that's Mary. So Mary, if you can send me a message, it's Mary127. If you want to DM me at OsteoStrong, and then I will connect you, or you can go right to Sandy. How do you guys want to go about it? Do you want the winner to just connect with you directly?
Yeah, you know, that would be a great thing. They can directly contact Linda at befree.love. So that way there's no middleman. But I also want to say, for those that are, now I can only say this of my studio I can't speak for other owners, but for those of you that are in South Florida, I am located in Fort Lauderdale in the Coral Ridge neighborhood. So for those of you that are local, I want to offer you to come in and try our system for completely free, and I want to do a free balance assessment for you as well. That's an assessment for your risk of falls. It's a test that can take for about 30 minutes to do. So if you're in South Florida, in Fort Lauderdale, look me up, contact us, and let us know that you are part of this conversation. So anybody that contacts me in the next week can have a free session and also a free balance risk assessment.
Awesome. Thank you so much. And then somebody is asking, how much is the kit to buy for the Be Free? How much are those kits?
The kits are currently on Etsy, and they're around $42. We were doing a Mother's Day special for mothers, and the products can be purchased separately. So you can purchase it as a kit, or you can purchase certain items separately.
Perfect. And if you want to send me a DM on Instagram as well and share, and I can post about your page on our page and share our story. I really appreciate you coming on and first donating a kit to a woman. I think that's my reason in coming in this community, is to brighten somebody's day and help them get through their journey. So I'm very grateful for you coming on. Sandy, thank you so much for this amazing
It really is a pleasure. Just to remind you, because we make these special order, we make them homemade, at least at the present time. I'm in the process of manufacturing some more spray. So maybe a couple of days before I get this out. The rest of the products I have in stock.
You know, Sandy, thank you again at OsteoStrong in Fort Lauderdale. We're super grateful for you coming on and sharing your knowledge about osteoporosis and the prevention and the things that we can do to really be ahead of the game. You know, like, let's catch it before it catches us. You know, like, let's be aware of our options. Knowledge is power. And we'd love to definitely have you back on. Obviously, my biggest thing is, just like breast cancer, it's not just October, it's 365 days a year. So just because it's Osteoporosis Awareness Month, let's make sure we continue the education going in our community, you know, for 2021 and going on. You know, let's just move forward and make sure that this is always touched, and anything you need to help, let me know, and let's get those changes in our community.
Thank you. Let's do it. Cheers. I'm cheering with tea. Thank you.
Cheers, definitely. So ladies, have a wonderful night, and we will be in touch soon. And
thank you so much.
Thank you so much. Everybody who won, make sure you guys DM us so you can get your goodies in the mail. Take care.
Thank you, Tracy. This is wonderful. I appreciate you having me on. What you're doing is beautiful, and I'm happy to support. And I have your fundraiser on our page, and I hope that our followers can help to support you, because what you're doing is truly beautiful and wonderful and empowering. So thank you for allowing me to share my little bit with your world.
Thank you. You know, as we said about the fundraiser, I guess I should stress a little bit and let you guys know that OsteoStrong Fort Lauderdale has started a fundraiser for $100 to raise for Rocket Strong, which will actually fund one woman a pre-mastectomy care package. So for all those small donations, they all add up. We're grateful for anything, and we really appreciate your support, because we want to make sure that more than the 48 women that we've already supplied since March continue to get these packages. So thank you again, and I'm truly blessed for this community.
Have a good evening.
Bye.